Welcome, everyone. We are now on day 4 of your boot camp workouts. I'll be going over the healthcare provider billing procedures today. This workout will have you running around, getting your medical bills ready to be submitted to the insurance carrier, and making sure everything is correct on your end. So I hope you had plenty of rest last night. You have your running shoes on and laces tied so you can keep up with me in this workout. This is your cardio day in the obstacle course by running around, finding all the information necessary to have a successful medical bill submission. In this workout session, you will learn how to complete and submit medical bills to the insurance carrier and the deadlines and steps for both healthcare providers and the insurance carriers. Let's get into our workout here while you run around by reviewing some of the essentials to bill a workers' compensation medical bill. Now that you have correctly identified an injured employee, as workers' comp, you've verified the correct employer's coverage information, and you have the carrier information like where you need to send the bill. Before I start, I do have to remind you of our disclaimer. My presentation today is for your education. However, system participants are responsible for knowing and complying with the statute and rules. If there were a dispute or complaint, the statute and rule will be used to resolve that issue. So it's very important to become familiar with the Texas Insurance Code, Labor Code, and Administrative Code. We want you to know exactly where to find this information, and that is why we are helping you by giving you the PDF interactive resources document, which is the roadmap to this information. And you can always call Comp Connection if you get lost on our website, and we'll be glad to help you. Here's an overview of what we'll be going over today. Our presentation today will include many twists and turns on the obstacle course, consisting of information for your administrative staff, mostly in the billing, coding, and medical records departments. We will cover completing a medical bill and specifically filling out the professional medical billing form called the CMS 1500. And some of you may refer to this form as a HCFA. This is used by doctors, physical therapists, and individual healthcare providers. Once you complete the bill, how do you submit the bill? What medical record documentation do you send? What does the insurance carrier do with the bill? What you will need to do to appeal the carrier's response, or EOB, also known as a request for reconsideration. And finally, some DWC resources for you. This might be a good webinar to take notes on those handouts that we sent you with your login instructions. That way you can refer back to them whenever you have a question. Okay, let's get into this workout. In workers' compensation, it is good to know the rules of the game, and in this case, the billing rules. I recommend starting with reading the rules to become familiar with the billing with the billing guidelines for workers' compensation. This is a good exercise for any new workers' compensation medical staff and for all healthcare providers to warm up for your workout. Remember, you are responsible for knowing the rules and the statutes. So basically in Chapter 133, you'll find all of the steps to bill and the timelines. Chapter 134 is where most of the reimbursement rules are. Chapter 133, this should be your water bottle for this workers' compensation workout. So let's pick up your water bottles and let's hydrate your mind with the information in these sections. After intake or registration and any necessary pre-authorization has been completed and treatment is provided, you'll be completing a medical bill. Chapter 133 is going to guide you through this process. If you look closer at what subchapters are included in Chapter 133 of the Texas Administrative Code Part 2, Subchapter A has general rules for billing and processing. Subchapter B for billing, it has all the healthcare provider steps for submitting a medical bill. C is what the carrier does once they receive your bill. D is for dispute of medical bills. And subchapter G, if you're billing electronically, this is where you're going to find the e-bill standards. Chapter 133, applicability. This slide is to tell you that all of the billing rules in Chapter 133 apply to both non-network and network claims. However, with network claims, there are a few exceptions, meaning these exceptions do not apply to network claims. The exceptions are the medical fee and medical necessity dispute resolution rules in subchapter D, section 133.210, medical documentation requirements do not apply to network claims, as the healthcare network may establish their own documentation requirements. And section 133.240, subsection B, which says that an insurance carrier cannot deny reimbursement based on medical necessity when the healthcare or services provided have been pre-authorized or voluntarily certified. And also subsection I of Rule 133.240, which is about reconsideration. So for non-network claims, a healthcare provider must request reconsideration from the insurance carrier prior to requesting dispute resolution for a denied bill. This does not apply to network claims because networks have different appeal processes. So be sure to check with the network for documentation, reconsideration, and dispute resolution requirements. Medical bill formats. Your medical bill will either be submitted by paper or electronically. Rule 133 informs you which paper bill formats are used and which fields are required, conditionally required, and not required. This includes the CMS 1500 or HCFA, UBO4, the 2006 ADA dental claim form, and the DWC 066 pharmacy bill formats. For those of you billing electronically, Rule 133.500 and related rules address those requirements and formats. Now we'll go over medical bill charges and quoting. A healthcare provider must charge their usual and customary charges, meaning you would charge the same amount for a non-workers' compensation patient for the same service, and you will generally be using the most current CPT HCPCS and ICD-10 billing codes for your billing. There's one slight exception, case management codes. And Amy will be going over case management billing in our healthcare provider professional reimbursement webinar on Thursday, August the 15th. So register if you haven't done so already. Medical bill submission. Who can submit a medical bill? Well, you need to know that if your provider is a licensed healthcare practitioner, they must bill under their own license. According to Rule 133.20, the medical bill must be filed under the licensed healthcare provider unless it meets these exceptions. This provision found in 133.20 is one that conflicts with Medicare's Incident to billing, where a licensed healthcare provider bills under another licensed healthcare provider's license number. This isn't allowed in the workers' compensation system due to this rule. So, for example, I once received a call from a healthcare provider because an insurance carrier denied their bill where the physical therapy assistant was the rendering provider and the bill was submitted under the physical therapist's name and license. She said that they've been billing this way for 10 years because Medicare says they can. I said, when there's a conflict in DWC rules and statutes and Medicare payment policies, our rules and statutes, and in this case, Rule 133.20 takes precedence. Therefore, because the physical therapy assistant is licensed, they have to submit their own bill. Unfortunately, for this healthcare provider, it had been more than 95 days from the date of service, so the corrected bill would probably be untimely filed, and more than likely the carrier is going to would have denied it. So don't let this happen to you. Make sure that you're billing under the licensed healthcare provider's name. Let's go into some of the details on the CMS 1500 or HCFA based on our rule and some of the issues that come up from your calls. The required billing rule can be found in Rule 133.10. This section outlines which paper form should be used for the different types of billing. Not only does it include instructions for the CMS 1500, which is used for professional billing, but also dental claim forms, pharmacy, and the UBO for facility or institutional billing. Every field that is required or conditionally required will be listed with the related field in parentheses next to it. That means that if a field is not listed in Rule 133.10, it is not required and a bill shall not be returned by the insurance carrier. Rule 133.2 defines a complete medical bill as one that follows either Rule 133.10 for paper billing or 133.500 if you're billing electronically. If you have entered all the required fields and or conditional fields with data, the bill should not, or I'm sorry, the bill should be considered complete and should not be returned by the carrier. Even if more than what is required is listed, a bill shall not be returned as incomplete. If data or information is populated in a field that is required or conditionally required, even if the carrier believes it is incorrect data or information, it is a complete medical bill. So, for example, when a healthcare provider enters the incorrect address for the employer in field 7 of the CMS 1500 claim form, that would still be considered a complete bill and should not be returned by the healthcare provider. And if you believe that the carrier is returning the bill that is complete, please go to Rule 133.10 to check for that exact information that is missing. And if you still feel like they are wrong, you may file a complaint, especially if it's a pattern of practice by the carrier. And you can find the administrative violations by an insurance carrier in Texas Labor Code section 415.002. And it's a good idea to include the section of that labor code with your complaint because it's helpful to that department. Also, you want to make sure to copy the insurance carrier when filing a complaint. This image here is of the CMS 1500 or HCFA version 212, which is the correct version, which a healthcare provider is required to use per Rule 133.10. It is used for professional billing and ambulatory surgical center or ASC billing. Required billing forms and formats. As I mentioned earlier, if a field is required or conditionally or situationally required, the field must be populated with something, and hopefully you have correct information that has been gathered during the intake. In this slide, you can see that for workers' compensation, the employer where the injured employee was working at the time of the incident is the insured. This employer's insurance carrier is responsible for medically necessary treatment for the compensable injury for the life of the claim, even if the injured employee has changed jobs 5 times and they're no longer employed there. The employer's address is important for insurance coverage verification and for this field number 7. It will help the carrier process the bill and the insurance coverage be verified correctly. Remember that an individual person can have multiple claims or injuries, so it's important for you to list the related employer for that particular injury in this field for this bill. The word claim in workers' compensation usually means injury or illness that is work-related. And in a healthcare provider world, sometimes claim means the individual medical bill. So be careful to distinguish between the two. Conditionally required under specific conditions. Note that the insurance carrier must not return a bill that does not have a DWC claim number, as it is only required when known, or should not return a bill when the claim is not established. Field 11 is a conditional field. Again, if you receive a denial, go look at the Rule 133.10 and compare it to what you billed and correct it. Correct it accordingly and quickly submit your bill to the insurance carrier within 95 days from the date of service. Please note that this rule has recently been amended to include the new billing requirements for designated doctors exams, which became effective on 6/1/2024. A designated doctor's assignment number is now required in field 23 for the DD exam bills and any related bills for referral testing providers. So if you haven't looked at this rule recently, please do so that you will know what has changed. And I'm going to go ahead and go to our website right now to show you where you can find the presentation that Amy presented with all the changes of the designated doctor changes in the rules. So you'll go here to tdi.texas.gov. You're going to select workers' compensation, and then you'll go down. Remember, you're not going to use the topics A to Z here at the top. You're going to go down to this one and click on workers' compensation A to Z. And then here you're going to go to the D and then go to designated doctor. And this is our designated doctors page. You're going to find the billing and reimbursement training for designated doctor and other certifying doctors exams here. This is new information based on the new rules and the amended rules. And then you can get the slides here for that presentation, and then the handout, which has a cheat sheet here on what to bill, how to bill, MMI, impairment rating, and other exams. And then handout number 2 is healthcare providers receiving referrals from designated doctors. It gives you the information on that and what to do. And it also points out example C here, the DWC assignment number is required in the pre-auth field. So that is new. And just wanted to show that to you so you know where to find it. So let's get back to our presentation. Okay, now let's talk about the healthcare provider state license format. I often receive calls in ComConnection from healthcare providers whose bills were denied because the healthcare provider's state license number was entered incorrectly on the bill, and the healthcare provider tells me that it was entered correctly. However, when I ask how the license number was formatted in the field of the medical bill, it's never in accordance with Rule 133.10F. The healthcare provider's license number must be formatted as seen here by the license type, license number, and jurisdiction code. And you must use a 0B qualifier when entering a provider's license number. Healthcare providers that do not have a state license number only need to enter the license type and jurisdiction code. Here are just some of the many different license types. Licensed healthcare providers may bill directly. For example, audiologists, if licensed, can bill, and will need to choose the best license type that fits for the type of medical services they were provided. You can find the complete list of license types in Rule 133.10, subsection I. Now let's talk about deadlines to bill the insurance carrier. You must submit your medical bill within 95 days from the date of service. That is outlined not only in the statute 408.027, but also in Rule Section 133.20. If you change a billing code, such as the CPT code, HCPCS code, or diagnosis code, it could be considered a new bill and must be done within 95 days from the date of service, or you'll risk a denial for submitting the bill past the 95 days. Corrections to the modifiers and number of units are allowed upon reconsideration. Therefore, the insurance carrier should not consider these corrections as another bill. You can find this language in the adoption preamble of Rule 133.250 in the Texas Register. If you would like this information and need assistance finding the language, you can call us at the ComConnection line, and we can help you navigate to the Texas Register's website to find this information. Now that you've completed your medical bill, we will now talk about how to submit your bill. This information is also found in Texas Administrative Code, Chapter 133, General Medical Provisions. How do you compute the 95 days? Well, Texas Administrative Code Rule 102.3 explains the computation of time and defines day and working day. If you are computing time by days, the first day is excluded and the last day is included. So, for example, when submitting your initial bill to the insurance carrier and the date of service is January 1st, 2024, you will start counting on January 2nd. That will be day 1 of the 95 days, and April 6th is the last day, which is the 95th day. If you're counting by months, we'll use the same example. For example, like when submitting your bill for reconsideration and the date of service is January 1st, 2024, you'll have 10 months from that date of service to submit the bill, and that period ends on the same numerical day of the 10th month as the day of the month from which you started counting from, making your deadline November 1st of 2024. What if the last day of the period is not a working day? Unless the rule says differently, the next working day will be used. A working day is defined as any day, Monday through Friday, other than the holidays mentioned here. When you see a rule that just says day rather than working day, that means a calendar day. Exceptions for untimely submission of a medical bill. What if you don't get your bill into the correct carrier within 95 days? Well, the good news is that there are exceptions to the 95-day filing deadline. Those medical bills that were incorrectly classified as either group accident, health insurance, an HMO, or the wrong workers' compensation insurance carrier, but were filed within the 95 days, can qualify for an exception to get your bill to the correct work comp carrier. The big note here is notice the exceptions do not include billing the patient for over 95 days or sending your bills incorrectly to the Division of Workers' Comp. Remember, we're not an insurance company and we do not pay bills. Or if you're billing the employer for over 95 days. In these instances, you will not qualify for an exception unless the carrier agrees to make an exception on their own. Please document what happened. Say if you were billing an injured employee over 95 days, did the injured employee not give you the information on workers' comp? You should have documented the circumstances and what the injured employee said when they were registered and on the way out if it were an urgent care or an emergency room. All self-pays, all self-pays, oops, I'm sorry, get out of my PowerPoint. All self-pays need to be paid special attention to, so you do not pass the 95 days. You may want to set a follow-up date for when you are billing the employer so you do not go over the 95 days and miss the opportunity to bill the workers' compensation insurance carrier if the employer does not pay timely. Give yourself some time to get that bill into the insurance carrier timely. Additionally, the statute also allows for an exception when there are catastrophic events like a hurricane that disrupts normal operating processes or a pandemic. In these cases, the commissioner publishes a bulletin and will outline the details. Like sometimes for hurricanes, only certain geographical areas meet this exception. For instance, the commissioner's bulletin B-0010-20 that went out on March 25th, 2020 referenced the coronavirus or COVID-19 workers' compensation issues. This bulletin allowed for tolling of medical billing deadlines and stated that failure to submit a timely medical bill would be deemed an exception due to a catastrophic event under Labor Code Section 408.0272, subsections B2. You should always pay attention to our bulletins for when the normal billing times resume. So if you're not already subscribed to our emails, please go to the healthcare provider page and click on that sign up that's underneath the What's New tile. Lastly, if you're past the 95 days, I would suggest that you send in the bill into the correct work comp carrier because they may make an exception that the law doesn't outline. Make sure to have documentation on what happened and that you did it all within your power to find out the work comp information upon registration and discharge. New 95-day filing deadline. You'll have a new 95 days once you find out the medical bill is workers' compensation, or once you find out the correct information. You need to have documentation that proves your medical bill qualifies for an exception to the timely filing deadline. This is when patient accounting software documentation is important. You need to know who you sent the bill to and why. When did you submit that bill to them? Was it within the 95 days from the date of service? You're also going to need to know the date when you found out it was workers' comp and who told you that it was workers' compensation and their contact information. We recommend that you refund any money, such as copays, deductibles, payments that were taken from the injured employee and quickly get the medical bill into the correct carrier within 95 days of the date you found out it was workers' comp. How do you meet an exception? Now, this is information that is not in our rules, but are suggestions on best practices in order to meet an untimely exception. So, as I mentioned on the previous slide, as soon as you find out the correct work comp information, you have a new 95 days from the date you were notified. Again, documentation is extremely important in order to combat any denials for timely filing from the carrier. So if you're billing another payer and you get an EOB or notice from that carrier or from the injured employee or the representative, or even from the correct carrier stating that they are responsible, you should very quickly send all bills related to that treatment or condition to the workers' compensation carrier and show your documentation that the correct workers' compensation insurance to that correct workers' compensation insurance carrier in order to avoid any questions on deadlines. Showing the date you were notified by who and how could be included along with the copy of the Texas Labor Code 408.0272. Billing the injured employee. Now we'll talk about pursuing a private claim against the injured employee. If you collected payments from the injured employee, we recommend returning these payments. If you do not return the payments made by the injured employee, you risk violation of Texas Labor Code 413.042. It is important to document what the patient said upon admission or registration and during intake and what they're saying now. If the injured employee files a complaint that you collected money from them for a workers' comp claim, we, the Division of Workers' Compensation, will look at whether 413.042 was violated or not. This is one of the number one reasons a healthcare provider can get into trouble with the DWC. You can go to the D and the workers' compensation topics A to Z for disciplinary actions where healthcare providers have been fined for collecting from the injured employee. You don't want to be added to this list of violators, so please do not do this. Labor Code 413.042 states you can bill the injured employee, but only if, number one, DWC determined that the injury is not compensable, which we call final adjudication, or number two, employee selected a doctor that was not permitted to participate in the workers' compensation system, and the doctor did not know of the violation at the time the services were rendered. Injured employees that have a network claim are responsible for selecting healthcare providers that are in the network. You can read more about this in Texas Insurance Code section 1305.451. And number three, when an injured employee has paid for when an injured employee has paid for medication prescribed by a doctor. This is usually when the pharmacist collects the cost difference of a brand name and generic drug. You can find more information about this rule in 134.504 of the Texas Administrative Code, pharmaceutical expenses incurred by the injured employee. What if the injured employee wants you to bill the private insurance carrier for a workers' compensation claim? Well, bottom line is to assess your risk violation of 413.042, because we can't tell you how to run your practice or medical office. Best practices is just that, nor can we guarantee an outcome in dispute resolution or in the complaint department. All evidence will be weighed, but do everything you can to find out if it's workers' comp or not. You may want to create a patient statement asking, is the treatment you're seeking for a work-related injury? Yes or no? Have the patient sign this statement. Do this for every registration, no matter if you think it is a work-related injury or not. If you did not get this in writing at the beginning, get it later. Collect those copays and deductibles and set up a payment plan with down payment for self-pay. Sometimes if they know their responsibility, they may change their mind And if they do, and you are collecting money or have collected money, they could file a complaint on you for violation of 413.042. The message is to stay on top of what they say and make sure they understand their financial responsibility either way. Let's move on now to billing the employer. Note that this would be the employer where the incident or injury occurred. Rule section 133.20 allows for the healthcare provider to choose to bill a willing employer. So if you have a good rapport with an employer who would like to pay you, the healthcare provider directly, that is allowed, but with some exceptions. When a healthcare provider elects to bill an employer, you waive certain rights. Those rights waived during the election period are prompt payment, interest for delayed payment, and medical dispute resolution. You can find this information in Rule 133.20. When you elect to bill the employer, you still must submit an informational copy to the insurance carrier. Even though sometimes the employers don't want you to do that, it is required. You must bill in accordance with the division fee guidelines and Section 133.10 required billing forms and formats. Once the healthcare provider chooses to bill the work comp insurance carrier, their election period ends and they do not waive their rights anymore. But they could miss the filing deadline if they wait too long. For this reason, you may want to consider setting ground rules for the employer. Set a deadline for the payment and give yourself enough time to send the bill for payment before the 95 days is up. I hear about this in Comp Connection all the time, where the healthcare provider is billing the employer and they're giving the healthcare provider the runaround about when they're going to send the payment, and then they never end up paying the bill. In most of these instances, the healthcare provider has waited months for the employer to pay and have now missed their 95-day deadline to send their bill to the workers' compensation insurance carrier. So don't do this, or you're going to miss your 95-day deadline if you end up having to bill the work comp insurance carrier. So like I said before, setting a deadline for yourself for payment from the employer is important. Now we'll go over some best practices for billing the employer. If you only have the employer information and they are not helpful in giving you the workers' comp insurance information and where to send your claim, you can get that from us directly. You do not have to get it from the employer. All you need is the employer name, address, and approximate date of injury. You learned this in the previous boot camp, day 3. Also, if you elect to bill the employer, you cannot balance bill the injured employee for the difference, and the employer does not have to pay the fee guideline amounts. We do not regulate how much they pay you. So if they pay you a cent, you may not bill the injured employee or the work comp carrier for the difference, and you may not go through medical fee dispute resolution process with DWC to dispute the payment because you waived your right to medical dispute resolution. Remember to use your interactive resources map to get you to the coverage verification page, or go to our DWC healthcare provider page and select the tile that says coverage verification. Let me go ahead and show you where you can find that. So let's go to your interactive. So here's your interactive resources document. Remember, you're not going to use this topics A to Z. So you're going to go down. You can either go to the workers' comp topics A to Z here. What you see here, to go to coverage to the C, or or you can scroll. I think there's you can just click, and I know some of these, the bolded headings, and every single heading or line here is clickable. So, even though it's bolded or unbolded, you can go here to coverage verification, and that'll take you directly to our coverage verification page. You can do your search here, verify coverage here, if they're an employer subscribed by a Texas insurance carrier, or if they're self-insured, or governmental entity, or if you want to look to check to see if they're a non-subscriber, you can go here. But once you do that, and if you still can't determine whether an employer has coverage, you can just send an email to this email address, coverage.verification@tdi.texas.gov. And you want to include the name of the employer, the physical address of the employer, and the date of the injury. And then you'll be notified, or they'll respond within 1 business day. So I just wanted to show you where to find that. You can also go to our healthcare provider page. If you go here, you're going to click on the workers' comp tab, go to healthcare providers, and you'll see here our new little page, and you'll go to this tab here, or this tile, coverage verification. Also, I wanted to show you here where to find the sign up link to subscribe to our emails, the e-news. So you would go right here, right below the what's new, and click on sign up, and then you would just enter all your information there. So I just wanted to show that to you so you can be familiar with where to go. Now let's get back to the presentation. Now let's go over medical documentation for non-network claims. You will find medical documentation requirements to submit with your medical bill in Subchapter C, Section 133.210 of the Texas Administrative Code. This rule requires your documentation to be in legible form and also goes over certain medical documentation that must be submitted along with your bill unless you previously provided it to the insurance carrier or its agents. This rule section requires a healthcare provider to submit medical documentation when you're billing for the 2 highest evaluation and management codes for new and established patients. These office visit notes and or reports must satisfy the AMA or American Medical Association requirements for use of those CPT codes. An operative report is required when billing for surgical services rendered on the same date when the total of the fees from the medical fee guidelines is more than $500. When billing for return to work rehab programs, you must submit copies of progress notes which support the care, improvement, the date of the next treatment, complications, and expected release dates. When a procedure doesn't have a maximum allowable reimbursement, you'll have to submit supporting documentation, which includes an exact description of the healthcare provided, and an itemized statement is required to be submitted for hospital services. If you're billing for a claim that's in network, the network may reduce documentation requirements. You will need to review your network contract or contact the network to verify what is required. Any required documentation already sent to the insurance carrier does not need to be resubmitted, as stated in Rule 133.210, subsection B of the Texas Administrative Code. Insurance carrier requests for additional documentation. When an insurance carrier requests additional documentation to process a medical bill, the request must be in writing and include a copy of the bill. It should describe information being requested and the specific reason for the request. The documentation must be relevant and necessary to resolve the bill and should be asking for information that's already in or being added to the injured employee's record. Insurance carriers' requests for additional documentation can be found in the Rule 133.20, subsection H. The healthcare provider has 15 days to respond to a request for documentation from the insurance carrier. You must submit the requested medical documentation related to the charges for the healthcare rendered or respond with a notice that you don't have the requested documentation. Just because the insurance carrier has requested additional documentation does not mean that their 45-day deadline is extended to pay or deny the medical bill. I'll be talking about what to do when the insurance carrier hasn't responded to your initial and or reconsideration bill submissions a little later in this presentation, so just hang in there. We'll now go over the insurance carrier's medical bill processing. This can be found in Chapter 133, Subchapter C, Medical Bill Processing or Audit by an Insurance Carrier. Processing an incomplete medical bill. When the insurance carrier receives an incomplete bill, it must add the missing information already known, except for the information listed here, or should return the bill and must do this by the 30th day after the date the carrier received the incomplete bill. For example, when the healthcare provider doesn't know the workers' compensation carrier claim number, the insurance carrier should not return the bill because this is information that they should have, and also because it's not required if unknown. Another example is when the healthcare provider doesn't include a social security number on the bill. The social security number is only required when the injured employee has one. So if the injured employee doesn't have a social security number, the field can be left blank per Rule 133.10, subsection G. And note that the 95-day deadline to submit a complete medical bill is not extended when the insurance carrier returns an incomplete bill. Processing a bill with no employer's first report of injury. When the insurance carrier receives a complete medical bill for a claim in which the employer's first report of injury is not on file with the insurance carrier should not be returning the bill as incomplete. As long as any other written communication, such as a healthcare provider's medical bill, which contains the name of the injured employee, it identifies the employer, has the approximate date of injury, and information that asserts the injury is work-related, the insurance carrier shall immediately create a written record on paper or in an electronic format of the earliest notice of injury. If the insurance carrier is notified of an injury for which it hasn't received an employer's first report of injury from the employer, the insurance carrier shall contact the employer regarding this injury within 7 days of notification. If they do return the bill, you may contact the insurance carrier and reference Rule Section 124.1, subsections A3, D, and F, that the employer, should be following, and may file a complaint if you feel the insurance carrier is in violation of a rule or statute. And I encourage you healthcare providers to include the specific Texas Administrative Code rules sections and or Texas Labor Code sections when talking to the insurance carrier or when you're responding to a bill denial or return bill, because the insurance will then know that you've done your research and that you're familiar with the work comp rules. And this may also help the insurance carrier know that they denied your bill inappropriately. I hear about this often in Comp Connection, and we are happy to provide you with the sections of the Texas Administrative Code and Labor Code for you to reference with your bill submissions or show you where to find them. A lot of the healthcare providers that I've talked to say that as soon as they start quoting rules and statutes, the insurance carrier often pays the bills. So again, it's very important to become familiar with the Texas Administrative Code chapters 133 and 134, as it does increase the chances of your bills being processed correctly by the insurance carrier. Processing a complete medical bill. The insurance carrier has 45 days from receipt of a complete medical bill to pay, reduce, or deny the bill, or to determine if they're going to audit the bill. Final action means they've provided you with an EOB. Medical bill audit. When the insurance carrier decides to audit a medical bill, they must notify the healthcare provider. They have to pay 85% of the reimbursement and must make a decision regarding compensability, extent of injury, and medical necessity. They must complete the audit and pay, reduce, or deny the bill not later than 160 days after receipt of the complete medical bill. Communication between a healthcare provider and insurance carrier. This could be in a letter communication, phone, and or EOBs from both the insurance carrier and healthcare provider. The communication must have enough detail to identify and resolve an issue or question about the bill. Generic statements with an explanation, or without an explanation, I should say, such as these two examples, are not enough. In the first example, the healthcare provider needs to explain why they feel the insurance carrier improperly reduced the bill and may want to include rule references or payment policy information so that the insurance carrier can understand why they billed the way they did. And in the second example, the insurance carrier should explain further as to why the documentation did not support the service or treatment being billed. Requesting reconsideration of your bill that was denied or that was paid, but the healthcare provider is unsatisfied with the payment made by the insurance carrier. You can find these guidelines in the Texas Administrative Code, Chapter 133, Subchapter C, Medical Bill Processing Audit by an Insurance Carrier. A healthcare provider must submit a reconsideration request no later than 10 months from the date of service. Please do not submit a reconsideration until the insurance carrier has taken final action on a bill, which means that the insurance carrier has processed your bill and has issued an EOB, or if it's been more than 50 days from submitting your medical bill and you still haven't received an EOB, then you can request it. If you haven't received an EOB, you can contact the insurance carrier to request the EOB be sent to you. Make sure you document how you requested the EOBs, and if requested by phone, document the name of the person you spoke to and their contact information, and may want to include the time of the call. Remember, the burden of proof is on the requester, and this information will be helpful to include in your position statement when submitting a reconsideration request. And if you end up having to file a medical fee dispute resolution request or a complaint with the network or DWC, sometimes you can go to the insurance carrier's web portal to pull the EOBs from there, which is convenient, but it's not always available for all carriers. If you have the adjuster's email, you can request it that way as well. And this way you'll have documentation to support you requested the EOB when submitting your reconsideration request. Your request for reconsideration must reference the original bill. So this means you must have the same billing codes, the dates of service, and dollar amounts. It must include a copy of the original EOB or documentation to support you ask for one if you never received one, just as I just mentioned in the previous slide. It must also include supporting documentation that was not sent with the initial submission of the bill. And it has to include a bill-specific position statement. This is where you want to provide as much information and details as to what you've done to try to obtain the EOBs, like I talked about in that previous slide, and why the bills should be paid. And you want to include rules and statutes as well. So, for example, if your bill was underpaid, you can explain in your position statement how you calculated the amount to be reimbursed and include supporting documentation such as a copy of the reimbursement for the code you billed from the physician fee schedule search tool that you can find on the cms.gov website. Or if you don't use that one, you can also use the Novitas fee search page along with the formula of how you calculated the billed amount, and include that with your reconsideration so that the insurance carrier knows how you came up with the billed amount. And this will increase your chances of the bill getting paid and getting paid correctly. Also, for the designated doctor staff that have joined us today, you can include a copy of the information from the reimbursement handout or cheat sheet that's on the designated doctor page that I showed you, and the specific rule section that applies. I showed you where to find this information earlier in the presentation. Again, this information will be helpful should you need a file for medical dispute resolution. Remember, the burden of proof falls on the requester, so any supporting documentation is helpful. The insurance carrier must return an incomplete reconsideration request no later than 7 days, or respond to the request with an EOB within 30 days of receiving your request. This should be the second EOB you receive from the insurance carrier. For oral requests for reconsideration, you, the healthcare provider, must clearly identify the service denied based on an adverse determination with explanation. and no later than the 5th working day, the insurance carrier must send the requesting party a letter acknowledging the date of the oral request as well as a list of documents they want submitted. Then what? Whether or not you got an EOB, a healthcare provider must not resubmit another request for reconsideration. If it's earlier than 35 days from the date the insurance carrier received your first request for reconsideration. If you are still dissatisfied, you may file a medical dispute resolution. If you have questions about which DWC administrative remedy to pursue, because there are several, please call us at Comp Connection and have your EOBs with you, and we will assist you in determining which one is right for you. Note that the medical bill, if the medical bill involves a certified workers' compensation network fee dispute, you will follow the network complaint process and not the dispute resolution process at the Division of Workers' Comp. You'll have to contact the network to ask where to file the formal complaint. You may choose dispute resolution, and your EOB denial will determine which dispute path to take. I would also like to emphasize that the DWC is not an insurance company, and we do not process medical bills. So please do not send your medical bills to this address on the screen, because remember, billing the Division of Workers' Compensation is not one of the exceptions listed in Texas Labor Code 408.0272 that we talked about in one of the previous slides. So don't throw away your money and this hour-long workout. You must submit your bills to the workers' compensation insurance carrier or a willing employer. You can go to our coverage verification page, where I already gone to and I showed you, and select the C for the coverage verification to find information on who the carrier is that is handling the injured employee's claim, or send that email to the coverage verification department. Also, please do not call the Division of Workers' Compensation or the Comp Connection line when checking status of a medical bill, or you'll have me looking like this. We usually see this from hospitals and their ancillary providers. Our agency is a regulatory agency and does not process medical bills, nor can provide status of your bills. All of your medical bills should be sent to the insurance carrier or sometimes the employer, and that is who you should be calling for the status of those bills. And I know I keep saying this, but it's not to reprimand you, but to help you so that you can get paid for the services you provided and not just throwing money away. Here's an overview of what we've learned today. We learned about billing rules, completing a medical bill, and the CMS 1500 or HCFA instructions, submitting medical bills, medical documentation requirements for a non-network claim, insurance carrier medical bill processing, requesting reconsideration, and other resources like best practices, rules, statutes, who to call for status of a bill, etc. That was the end of our healthcare provider billing procedures presentation, and now we want to flex your knowledge. I'll be putting up 5 polling questions to see how well I did at presenting the healthcare provider billing procedures to you and what you learned today. Okay, so question number 1, a medical bill that contains all required and conditional fields is considered a complete medical bill. The answer is true, and yay, 80% of you got that. Great. Just remember, you can always go to Rule 133.10, subsection F, and compare your bill to the requirements in the rule to make sure that all the fields required are populated. Moving on to number 2, a healthcare provider may choose to bill the injured employee for all or part of the healthcare provided for the work-related injury. That answer is false. If you do this, you risk violating Texas Labor Code 413.042. So you don't want to do this, or you'll be added to the list of violators on the DWC website. And And question 3, any workers' compensation medical bill must be submitted within 95 days from the date of service. That answer is true. And you can find this in Rule 133.20, and the exceptions can be found in Texas Labor Code 408.0272. If the carrier receives a medical bill for which it has no employer's first report of injury, the carrier shall contact the employer regarding the injury within 7 days of notification. This answer is true, and the majority of you got it correct. You can find the information in Rule 124.1. Remember, they have 7 days. The employer has 7 days to contact. The insurance carrier has 7 days to contact the employer. And question number 5, an insurance carrier must pay, reduce, or deny a complete medical bill within 45 days from receipt. And this answer is true. You can find this in Rule 133.240. And even if the insurance carrier requests additional documentation, this does not extend their time to pay or deny the bill. They still have to process that bill within 45 days from receiving a complete medical bill. Well, thank you. Thank you all. You all did great. I'm going to stop. Well, I don't even know if I was sharing this. I'm sorry. So now back to our presentation. Next time, as we move on through our obstacle course, where the healthcare provider will be swinging their bill to the insurance carrier, and hopefully the swing back will be a payment from the insurance carrier. And we'll be carefully watching all the hard cardio workout that was done in the healthcare provider billing procedures from the treehouse. We'll be going over how to calculate professional reimbursement, knowing some exceptions to the Medicare payment policies, and understanding billing for workers' compensation specific services like FCEs or functional capacity evaluations. Like always, please contact us at Comp Connection if you have any questions about today's presentation or about any other topics that you have questions about. You can also send your questions to our Comp Connection email address listed here, posted here, compconnection@tdi.texas.gov.